My name is Malton Scheckcenter, and I'm the creator and founder of the Erase Your Back Pain program. And today what I'd like to do is to talk to you about a condition that we see quite often in the clinic, and it's a condition that I refer to as lumbopelvic syndrome. Now, this syndrome is characterized by a change in function between the lumbar spine, which is the last 5 vertebrae of the spine, and the pelvis, hence the name lumbopelvic syndrome. And the primary problem that develops is a problem that happens with this particular muscle right here. And this muscle is called the psoas, and that's spelled P-S-O-A-S. And the psoas is connected to the lumbar spine, the upper portion of the lumbar spine, and runs through the pelvis and joins up with another muscle on the inside part of the pelvis called the iliacus. And together with the psoas, they form a common tendon that attaches to the front side of the hip. Now, over time, and as a result of prolonged postures that we assume, in particular sitting, we do a lot of sitting throughout the day, and in fact have become overall a very sedentary society by and large. What happens with these prolonged postures is that this psoas muscle begins to shorten. As it begins to shorten, two things start to occur. Number one is that because of its position here and the angle at which it can pull the spine, it will pull the spine into extension, or in other words, it will create a sway back in the spine. Okay? So that's number one. There's changes in the spine here as a result of pulling of the psoas. And then, because of its position on the front side of the hip, the entire pelvis will begin to rotate forward to accommodate this accentuation in this curve here, the sway back in this low back area. The pelvis begins to rotate forward like this. Now, what that does is it places a tremendous amount of stress on the joints of the low back, as well as on the discs between the vertebral bodies themselves. So over time, again, this accentuation in the lumbar curve, this constant pressure in the disc will result in some degenerative changes in the disc, can result in some degenerative changes in the joints themselves, and once again create some irritation to the nerves that exit the spine, creating sciatica and some of the other conditions that we'll see. So, in order to treat this effectively, what we have to do is we have to go to the source of the problem, and the source of the problem, like I said, is this muscle here called the psoas. In fact, this muscle is so important that if you were to tell me, Malton, I want you to identify everything that's wrong with my back. Tell me what there is, what those problems are, list them for me, but you can only treat one thing. If that were my directions from you, then I would treat the psoas if you had a psoas problem. Hands down. This muscle right here creates more dysfunction in the lower back, is responsible for more lower back pain than any of the other muscles combined, pretty much. So that's how important this particular muscle is. Now, like I said, to treat this problem effectively, you have to, number one, be in a position to identify this, and then number two, you have to be able to sequence the order of treatment that you're going to be implementing in a particular order. If you don't, if you just take the bowl of spaghetti and throw it against the wall hoping that something sticks, you won't be effective in treating this problem out, and you'll continue to have these ongoing symptoms that will continue to present to you over time. So, again, just to recap, lumbopelvic syndrome is a problem that develops between the lumbar spine and the pelvis as a result, in most of the cases, of this muscle called the psoas shortening. I hope the information I provided you today has been helpful in your understanding of why you have these types of conditions. And if you'd like more information about how my program might be able to help your particular situation, feel free to visit me at the link you see right below this video. This is Mountain Schexnayder wishing you all good health, and I do hope our paths cross soon.